Developments in the fight against cancer. You're going to want to hear this. Drug makers are announcing early success in clinical trials where drugs are boosting the body's own immune system to fight the deadly disease. Joining me now with details, Dr. Philippa Cheetham, urological surgeon and clinical fellow at the Columbia University Medical Center. Welcome to the show. It is terrific to have you here. I think this is really exciting because you're using the body's own natural defense to fight this horrible disease.
Well, this is really exciting, Jerry, and in fact, the American Society of Clinical Oncology had their annual meeting in Chicago, and this data was released as recently as yesterday, and they actually published the information online in the New England Journal of Medicine today. So very exciting news, looking at a drug that is stimulating the immune system, helping the immune system to recognize cancer cells and destroy them. This is superb research.
Beat up on those cancer cells. I like that a lot. Everybody out there knows somebody who's had cancer, and maybe they've had it themselves. You say that in some cases here, it's in clinical trials. It's not available for sale, but people could become a part of these clinical trials.
That's right. I mean, the data that was published today was looking at skin cancers. They've also looked at this class of drugs in kidney cancers and in lung cancers. They've also tested it with other cancers. Some cancers have shown to have a particularly good response, like the skin cancers, kidney cancers, lung cancers, and I'm sure over the next few months we'll see more cancer drugs being tested, more cancers will be used to look at the experimental data.
How did this come up? I mean, how did somebody come up with this idea?
Well, this is not new. I mean, even in the 1800s, they were looking at the immune response in connection with bacterial infections, and they showed even so many years ago that if you had bacterial infection, that could stimulate your immune response to fight cancer. Obviously, that was very primitive. We've come a long way. There's research that's come out of Yale that was looking at this initially. The data today was published in the University of California.
Let's go over a couple of those details right now. So Merck has a drug out that they're working with in clinical trials. They significantly shrunk tumors in 52% of the patients on the highest dose. And then there's Bristol-Myers Squibb. Their tumors shrank an average of 80%. This is Bristol-Myers Squibb. There it is right there. So big leaps. Now, how long does it take something like this to go from clinical trials to the market?
Well, first of all, Jerry, with these drugs, we need to get FDA approval. So these drugs are available at the moment in clinical trials, but they're not commercially available. But this can happen particularly quickly in drugs like this. The FDA labeled this drug as a breakthrough therapy last month. And what that means is that these drugs can be expedited to get to patients who really need them, particularly in advanced cancers where there's very little alternative available. So this is very exciting.
Now, a lot of the regular traditional methods of dealing with cancer, trying to kill cancer, chemotherapy, lots of side effects, negative side effects to that. Do we know anything about the side effects of this technology?
We do know about the side effects, and as you've quite rightly pointed out, many of the chemotherapeutic drugs that we have are very toxic. They're poisonous to many cells in the body. These cells that stimulate the immune system have actually been shown to have much less in terms of side effects. There are some side effects, but they tend to be low grade, things like fever, chills, fatigue, which we see with a number of patients, but they're not the severe side effects that we see with the common chemotherapeutic agents that we're using today.
You know, I don't want to get way out in front of this story because it always takes a long time for these things to be proven and to actually work, but you seem hopeful.
I am hopeful, and the patients that they've looked at so far have very advanced disease. These are patients with very advanced skin cancers, metastatic kidney cancers, metastatic lung cancers, and if we're seeing a response in these kind of patients with very advanced disease, then hopefully there's hope for patients with less severe disease as well.
Very interesting. Doctor, thanks for joining us today.
Thank you.
Pleasure to have you on the show. Thank you.